The numbers are high and getting higher. More than 5 million Americans have Alzheimer's disease, the leading form of dementia. That number could triple by the middle of the century. It's a coming public health crisis with no cure at this point and no prevention. A package of 10 bills to address this growing problem is winning bipartisan support in the Wisconsin legislature. Among the ideas, to invest $1 million in respite care programs and increase the number of dementia care specialists in rural areas. We're talking more about this now with Tim Harrington of the Alzheimer's Association of Southeastern Wisconsin. It's good to have you on the program.
Thanks, Mike. Good to be here.
So are you encouraged by what you're seeing from our state lawmakers?
I am. I think that this package that they put together is, as you said, comprehensive, and it really covers a broad range of things that families, individuals living with the disease are dealing with. And these are really going to help address these issues and hopefully get us, ahead of the game as the aging population increases and more people have it.
Where are we in the game, as you call it? Where are we in terms of trying to find a cure and trying to find a way to prevent Alzheimer's?
I think we're moving along well. On a national level, just recently, in the last budget, Congress approved $350 million for Alzheimer's research to the NIH, which is by leaps and bounds the biggest increase that we've seen in ever. And so that puts them at about $1 billion for research. Next year, they should get another $300 million. So, they're moving along as far as the dollars for research, and that's the thing that researchers have really been saying have been holding them back. That they've got the, they've got the minds, they've got the technology, they just need the money to get those clinical trials going and off the ground.
When are we talking about a cure for this disease, or is it too soon to be talking about a cure?
No, I don't think it is. Back in 2010, President Obama and Congress put into play the National Alzheimer's Project Act, which is basically a national plan to combat the disease, try and find a cure. And the goal is 2025. And researchers are very optimistic that with this extra money that they're getting, that they can at least find a way to prevent or treat it, hopefully cure.
Without a cure, are we really talking about a looming health crisis, or is the crisis already here?
Well, I think the crisis is here, but it's getting bigger. In the state alone, we have an estimated, based on a state public health survey that was just done, 115,000 people living with the disease now. If nothing is done in the next 20 years, that could increase by 68%.
And when we say people living with the disease, there are also spouses and family members. I remember talking with former Governor Martin Schreiber, who's dealing with a family issue of his own. And he was describing for me the absolute exhaustion that comes from being a caregiver for those with Alzheimer's.
Yeah, and he's absolutely right. I was a caregiver for my father, who passed away from Alzheimer's about 7 years ago, and it is exhausting. And without people finding resources, finding help, like the Alzheimer's Association, other people, a lot of people just don't know where to turn. It's increased stress, anxiety. It takes a toll on you physically, mentally, and certainly financially too. As you start caring for someone, those medical bills just increase, and it can be, as Marty put it, and Marty, is in our office quite often. The medical bills for the caregiver can go up because you concentrate so much on the duties of caring for your loved one that you forget about yourself. And that's really what some of these bills are there to increase too, or there to help.
At this point in time, I sense that you do feel a sense of optimism, though, that things are moving in the right direction.
I do. I think both in the state and nationally. I mean, our state, you got to give the department, DHS, Kitty Rhodes, and this task force a lot of credit, because they're really working toward making Wisconsin a dementia-friendly state. Dementia-friendly workplaces. They just came out with that toolkit. And again, with research, more dollars that go in, the closer we are to a cure. So I think that while it's tough to be around, while it's tough to see every day, certainly in our roles at the Alzheimer's Association, I think we're all encouraged by what's happening.
Tim Harrington, we appreciate your time today. Thanks very much for being with us.
Thank you.
When we come back, why are other states having all the fun this time of year?